Hello, it's Damien Lilacs. I am here today to do a video about autism. I have some personal experience with family and I have done some research. Also, I am autistic, so I have a bunch of personal experience and I have done research with credited sites that I will be linking in the description. If you want to go see more information about people with autism, I did not add everything, so there's a bunch more to learn. Although in this video we will be covering red flags, social signs, communication signs, unusual interests and behaviors, other signs, and lastly, medical conditions possibly linked to autism. Red flags. Some red flags are not responding to their name, lack of pretend play, avoiding eye contact, problems with feelings, delayed speech and language skills, when they repeat things, when they get upset about minor things, obsessive interests about different things, odd body movements to stim. And stimming is something autistic people do to relax their anxiety or focus, help with their oversensories that they're going through, which the next one is odd reactions to things that involve the sensory system. Doesn't look when others point and doesn't point at things. Lastly, give unrelated answers to questions. Social signs. Some social signs are avoiding eye contact, unresponsive to their name, prefers to do things alone, doesn't share interests with others, only interacts to achieve a desired goal, flat or inappropriate facial expressions or words, avoids and resists physical contact. When distressed, they do better alone, problems with feelings, doesn't have a grasp on boundaries. Boundaries such as what to say and physical and all different areas of boundaries, which a lot of autistic people don't mean to because they do want their boundaries to be respected. It's hard for them to know what's right and wrong as much. Some of them, not everyone. Next one is communication signs. Some communication signs are delayed speech or language skills, when they repeat things, reverse pronouns, flat talking, avoids pretend play, it's hard to understand jokes, sarcasm, and teasing for them, gives unrelated answers to questions, doesn't look when others point or point at things, use few or no gestures. Unusual interests and behaviors are lines up things, messes with things the same way, likes parts of objects, very organized, gets upset over little things, obsessive interests, follows certain routines, and moves in odd ways to stim. Other signs are hyperactive, impulsive, short attention span, aggression. Sometimes people with autism do self-injure themselves. It is not a good thing, and there are methods that can help prevent this and what to do when you see someone that is doing this to themselves. There's so many methods you can do. I suggest go see a professional and look up what to do with them and figure out from there what to do for that individual autistic person, because not every autistic person can be helped in the same way. So you could do more harm than good if you do it wrong. So please, I suggest go seek a professional help to figure that out instead of me trying to throw out different ideas, which I might do at one point, although right now that's not what this is about. Although the next ones are temper tantrums, odd sleep and eating habits, odd emotional and mood responses, lack or more fear than expected, odd reactions to different things with the sensory system. Medical conditions possibly linked to autism are seizures, GI issues, feeding issues, disturbed sleep, anxiety, depression, OCD, Fragile X, ADHD, schizophrenia, and bipolar disorder. Autism and seizures. Up to a third of autistic people have seizures. Seizures affect 1 to 2% of the general population. Please seek medical help if you or anyone experiences seizures like symptoms. Epileptic and non-epileptic seizures are dangerous. I do have seizures, so I do know if a seizure lasts for more than 5 minutes, please go seek medical help. You can have brain damage after 5 minutes of a seizure. Also, if you get hurt during a seizure, please go get medical help. Some red flags for seizures are unexplained staring spells, involuntary movements, unexplained confusion, severe headaches and migraines, sleepiness, disturbed sleep, unexplained inabilities to deal with actions and emotions. Autism and GI issues. GI problems are 8 times more common in autistic people. Commonly, that includes chronic constipation, abdominal pain, gastroesophageal reflux, bowel inflammation. Autism and feeding issues. This affects 7 out of 10 people. Extremely restricted food habits and aversions to certain tastes and textures can occur. This happens due to either hypersensitivity or wanting to eat the same thing because it is a stimming method. Chronic overeating or pica can occur. Pica is when you eat non-edible items. Autism and disturbed sleep. Over half of the people with autism have 1 or 2 chronic sleep problems. Sleep issues can tend to cause worsened behavioral changes, interfere with learning, and decrease overall quality of life. Autism and anxiety. 42% of autistic people have anxiety. Roughly 3 to 15% of general population deal with anxiety. People with autism tend to have issues with assessing and expressing feelings, which can lead to anxiety. People can experience anxiety during activities they enjoy. Social anxiety can cause scared to meet new people, scared of social events. Anxiety can cause physical symptoms, racing heart, muscle tightness, stomach aches, and some people say they feel something like frozen in place. Autism and depression. Depression affects roughly 7 to 26 of the autistic population. Roughly, depression affects 2 to 7% of the general population. Depression goes up as people with autism get older with age and intellectual ability. Depression can be masked in people with autism due to the communication challenges. Please seek help if you or anyone you know suffers from depression. I have a hotline that works with autistic people on the left of this slide. Signs of depression. Loss of interest in one's favorite things, noticeable worsening in hygiene, chronic feeling of sadness, hopelessness, worthlessness, and irritability. In more serious cases, which you should seek help if you experience thoughts about self-harm, death, or suicide. Please seek help if you experience depression symptoms. There is a suicide hotline that I do have on the page. They do work with autistic people. I have not used it, although I do suggest at least trying to call someone if you can. Maybe use this hotline if you're feeling like you need someone to help you. Seek out help. People are there to take care of other people. Autism and OCD. OCD is more common in autistic people than the general population, although it is hard to pinpoint what is a repetitive behavior due to autism and what is OCD. Autism and Fragile X syndrome. 2 to 6% of autistic people have Fragile X, making it one of the most common single genes to cause autism. People with autism and Fragile X tend to be more socially responsive, like such as smiling, and they tend to have more repetitive behaviors, although people with autism and not Fragile X tend to not have these traits. Fragile X syndrome symptoms. Intellectual impairment that ranges from mild to severe, attention deficit to hyperactivity, anxiety and unstable mood, autistic behaviors, sensory integration problems, speech delay with expressive language more severely affected than repetitive language, seizures which tend to affect about 25% of people, imbalance of eye muscles, serous otitis media, fluid in the middle of the ear that isn't infected, flexible joints, and mitral valve prolapses. The following table helps to explain this by discussing several shared characteristics between FXS and autism and how they differ. Similarities and differences between Fragile X syndrome and autism. Characteristic: social avoidance or withdrawal, Fragile X syndrome. Shyness and avoidance due to social anxiety despite being friendly and sociable. Autism: lack of understanding or skills of social interaction. Characteristic: low eye contact, Fragile X syndrome. Avoidance of eye contact. Autism: lack of understanding of eye contact. Characteristic: self-injury, Fragile X syndrome. Typically hand biting in response to anxiety or excitement. Autism: variable to type and cause. Characteristic: difficulties with symbolic play using one thing to represent something else. Fragile X syndrome. Delayed. Autism: distorted or impaired. Characteristic: language difficulties. Fragile X syndrome. Repetitive, rapid, and clustered speech, may repeat hard phrases, echolalia. Autism: variable language difficulties. Characteristic: facial expression recognition. Fragile X syndrome. Typically a good understanding. Autism: lack of understanding. Characteristic: understanding of other people's feelings and beliefs, theory of mind. Fragile X syndrome. Distorted by not absent, related to level of learning disability. Autism: impaired. So those are some of the characteristics and how they are different and similar. Mostly kind of different. I mean, there are some similar stuff, but there is a difference that is listed here. Autism and ADHD. ADHD affects 30 to 60% of autistic people. 6 to 7% of the general population have ADHD. ADHD shows persistent pattern of inattention, difficulty remembering, problems with managing time, organizational tasks, hyperactivity, and or impulsivity that interferes with daily life. ADHD and autism overlap a lot, and I strongly suggest getting tested and evaluated for both. Autism and schizophrenia. Autism and schizophrenia similarities. Challenges with processing language, challenges with understanding others' thoughts and feelings. Autism and schizophrenia differences. Schizophrenia has psychosis. Autism emerges rapidly in childhood as schizophrenia emerges closer to adulthood. Autism and bipolar disorder. People with autism are hard to diagnose with mania. Autism and bipolar disorder are similar and different in many ways, which make it hard to diagnose someone with one or even both. Manic episode symptoms include acting unusually happy, upbeat, and weird, increased energy and agitation, exaggerated sense of self and inflated self-esteem, sleep disturbances, getting easily disturbed. Depressive episode symptoms include acting or feeling down or depressed, sad or hopeless, loss in interest in normal activities, dramatic changes in appetite, unexplained weight loss or weight gain, fatigue, loss of energy, and frequent sleeping, and it is hard to focus. Autism symptoms include a hard time with social interaction and communication, taking in a part of participating in repetitive behaviors that are hard to disturb, and showing very specific preferences or practices that are hard to change. That is all that I have on autism for right now. If you liked this, please hit the like. If you want to see more, please subscribe and hit that bell if you would like to be notified whenever I post. I post every Tuesday and Friday, 12 p.m. CST time. I do have a Facebook and a Twitter account if you would like to follow me. I do also have a Discord that I am wanting some feedback for information on what kind of videos you like from me. I love to do these type of educational videos, and I really loved preparing this. So I would like to know, though, what my viewers like. So if you don't mind commenting down below or shooting me a message on Discord, all my information is on the YouTube channel that I have. But I hope you have a good day. Bye!